Today we have with us Dr. Tanuja Tamhankar ma'am, who is a senior dermatologist from Pune, live with us to educate us more about acne management. Dr. Tanuja is a young, vibrant, and highly skilled dermatologist with over 15 years of experience in the field of dermatology and cosmetology. Dr. Tanuja is currently practicing at Novo Grace Skin Clinic at Kothrud. So, ma'am, we welcome you. It is a pleasure to have you in our show.
Thanks a lot.
Ma'am, there are many things that our live viewers would like to know about acne management. So let's first start with the meaning of acne. So what is acne basically?
Basically, acne is a terminology which we medically use for acne vulgaris. And in common terms, we use words like pimples or muhaseb in Hindi. So these are the common terms which people do. So acne vulgaris is the medical name of the problem, which is a problem of the sebaceous glands, basically, which is induced by the because of the hormonal, it's not fluctuation, but normal hormones can cause receptor, at the receptor level there is problems, and which will cause the blockages, and then all the pathogenesis of the acne will start. So acne vulgaris is the medical terminology for the disorder of the sebaceous gland, which causes the formation of comedones, and then the cysts, nodules, and all the cycles of the acne pathogenesis which starts from that. So hormonal imbalance is one of the reasons. Basically, what happens is during when we attain our puberty, so there is a component of hormonal imbalance is there. The stability of the hormones are not there, and there is genetic predisposition also. So not all the people who are having these acne, not everyone will be affected by acne, but few people who have more susceptibility at the receptor level. So there are a lot of there have been a lot of studies going on which determines that at the receptor level, the sensitivity to the hormones is aberrant and is wrong, and that's why all the cycle of this formation of the blockages and then the formation of acne and everything starts. So basically there are other factors also, not just the hormonal imbalance. There are other factors like our lifestyle, eating patterns, our exercise patterns, the amount of stress we are having, then sun exposure. So all these are the factors, our food intake, what kind of food we are eating, and along with that, because everything has internal effects, so each and everything will go down to our internal metabolism, our internal mechanism, which get aberrant because of the problem, and then the chances of we getting acne or other skin problems increases. So depending on the grade, if it is once or twice it is coming and then just going, so probably like we can do something which like to a topical application of single creams or something like that, which will take care of the pimple for that particular amount of time, and then it will go off. But if we are getting recurrent, if it is causing sequelae of the side effects like pigmentation, scarring, we are not scared for pigmentation because pigmentation is 100% curable, but we are more concerned about the scarring. So if scarring is getting done, then definitely scarring is a permanent thing which will affect your skin throughout your life. So that's why the treatment becomes very much important when it is recurrent and when it is coming again and again, and most importantly if it is causing scarring. So scarring also, not everyone will get scars. It is also the kind of skin you have, the kind of scarring tendency you have, the kind of pimple you're getting, accordingly the scarring will be determined. So especially my concern becomes that patient should not be scarred at any point of time. So scarring should be prevented because everything else is achievable, but scarring is the thing which is like not 100% curable. So once a scar is always a scar. So it's like basically depending on the grade of acne. See, when we see a patient of acne, if the person is coming in early teens, like 17, 18, then I have to treat the patient for maybe 7 years, 8 years. So majority of times, what is the tendency of the patients is like they'll come to doctor, they'll think that this thing will be treated in 1 or 2 months and then it will go up permanently. So it will not happen that way. If you're proper, you are a proper acne vulgaris patient. Okay, if it is a few breakouts because of a single episode of some other things like a few food habits or some stressful environment, it will just go up. But if you have I'm talking of people who are having acne prone skin. So the skin type also determines how your skin will behave over the period of 10 years or so. So if you're a typical patient of a acne vulgaris where you're having a grade 2 to grade 4 type of acne, then what happens is you have to take the treatment for a long period of time, because it's not just like any fungal infection that we have treated and it's gone. It is, the patients do have that notion that we'll get treatment for 2 to 3 months and then it will be over. So one thing I want to tell everyone, that it's a long-term process, like, because the moment we'll stop the treatment, patient do experience that यूजुअली मेरे पास कैसे आता है कि पेशेंट बोलते हैं कि अभी तक तो सब ठीक था, लेकिन जैसे ही ट्रीटमेंट बन गया वैसे फिर से आने शुरू हो गए. सो वी हैव टू काउंसल इन सच अ वे दैट यू हैव टू हैव अ मेंटेनेंस फेज आल्सो along with the proper treatment. So once we have treated a patient, then starts the maintenance phase. So we have to complete the maintenance phase, and our work doesn't stop after just eradication of pimples. So we have to treat the acne pigmentation also, we have to treat the scars also. So treatment of all these things do require lasers, surgical methods, and there are n number of surgeries and different treatments available which will handle each and every kind of scars. So yes, it's not just the medicines and the cream which we are supposed to apply for maybe a year, maybe a 2 months or 3 months. It is a long going process first. Second thing is definitely in case of sequelae, like if scarring and other things are there, we have to there are many surgical as well as medical as well laseral treatment available in the market, which we have to do so that your skin is better and the patient get a confidence back, because we have to take care of the psychological health also. So since it do affect the quality of life of the patient, so we have to treat in that way. It's not just if one treatment will work for you, the second treatment won't work, that treatment won't work for you. So it's always a individualized approach. We have to see how the condition is. I cannot tell that one thing which will be a common thing which will remove your pimple, but I'll say one thing, that a good skincare routine will definitely have good effect on your skin. So even if you're having pimple or you're not having pimple, a good skincare routine which everyone should follow, that is the most important thing which we have to take care. A healthy diet and a good moderate amount of exercise and like good sleep, enough water, and if you're eating healthy, then definitely we will have a better skin. So basically skin is just the reflection of our internal self, and patients who are having pimples and other things, they have like marginal level of hormonal irregularities and other things which can be related to metabolic status also. So we have to treat that also. So that's what I'm telling you. It's not a just one-to-one approach. It's a multi-dimensional treatment approach which we have to follow. So basically, there are 4 grades by and large of acne. So first grade is when we have just small comedones in our skin, like when the patient is in teenage, when patient enters, we see small whiteheads and blackheads. So very few comedones. This is like grade 1 acne. Then along with comedones, if there are little bit of pustules and pus-filled lesion also, or nodules also, a small plaque also, then is grade 2. Grade 3 becomes when along with that the infection is more, if it is affecting the dermis of the skin, if many nodules are being formed, cysts are being formed, it is grade 3. And grade 4 is the major form where there are many cystic lesions in the skin and your skin is very scarred. So grade 3 and grade 4 are the lesions which will cause scarring of the skin. Definitely we need to start treatment. We cannot stop the treatment for this patient, and we have to do whatever possible so that their skin should not be scarred. So scarring is the one thing which is really dreadful thing which we think about for pimple, because we know that over a period of time pimples will go, everything will go, but what will remain is the scarring. So basically grade 3 and grade 4 kind of pimple definitely do scar, and we have to prevent them. That time we have to really intervene in the form of medical treatment, in the form of tablets, and only lotions and everything won't work for that. Depends. Actually, what I say is for patient who is having a proper acne prone skin, like having a skin of like seborrhea, if a lot of oiliness is there, that time the treatment duration maybe is for like 10 years or so, 10 to 15 years or so. So usually the cycle will start in around, the pimple cycle will start at around early teens, like maybe 16, 17, and then it will go on till 25 to 27. So already 10 years time frame is there. If patient is having occasional acne because of other factors, then definitely the time duration will be less. I'm talking of proper acne vulgaris patient who are having acne, oily skin, and they are very prone for acne and all. For them it does probably for 10 years or so. Actually, maintenance, see, patient don't need to come to us. So he will be in a maintenance phase where because there we cannot reduce the kind of sensitivity their hormones have over their sebaceous ducts. But what we can do is we can change the morphology of the skin in such a way so that that ill effect is not there. So we try to maintain a good skin. We try to maintain a skin so that it is regenerating. It is not causing clogging of the skin, so that your patient's skin is better. And the creams which we use is like, they are like very much safe for long-term use. So they are very good cream. So once patient get used to that, so if they apply in the night, morning, they'll have excellent skin and they'll just love their skin. So that is what we try to achieve. Yes, definitely. So majority of patients who get the typical acne vulgaris, the majority of patients usually we get around teenage or the early 20s. They have very acne prone skin. So the skin is very oily kind. Okay. There are nowadays we get a lot of patients in their mid 30s or early 40s also who get acne. These are hormonally driven acne. Their skin is there. It may not be very oily kind. Only the T zone will be oily. But and the kind of acne they will get will be different. So they'll get acne over the jawlines and not over the cheek, but over the jawline. So that is typical of middle-aged acne, which are typically seen in patients who are having hormonal irregularities or hormonal imbalance at that age. And people who are having acne during their teens, like the teenagers acne, it's like they have oily skin and they'll have lesions over the cheeks, over the forehead. So there are other acne variations also, like patients taking drugs, like patients taking steroids, patient taking anti-tubercular drug or anti-convulsant drugs and other antidepressants, and there are other drugs given for mental issues. So these drugs do cause acne. So that kind of acne are different. So these are like drug-induced acne, and their morphology and the kind of lesions are different. The patients who are having acne in their early 20s or the teenage acne, that the morphology of these acne are different. The acne of the middle age, it is different. So we have to, depending on the kind of lesions we are having, we have to determine the kind of pathogenesis or the etiology, and then we have to come to the conclusion, and then the treatment will be started. Yes, definitely. So if it is infected, if it is affecting dermis, mainly the pain is because of the inflammation and the infection. So that time definitely we'll have to treat the inflammation as well as the infection. And yeah, these are the kind of acne which will like are more prone for scarring. So we have to be very careful when we are having painful kind of, because see, there are lesions which are superficial to the skin. They'll just be not looking good, but definitely they are like, they will be like not looking good, but they won't cause scarring. They just leave a pigmentation and will go off. But the lesions which are deep-seated, lesions which are there over the dermis or the internal layer of the skin, and if they are infected and inflamed, then definitely these are the lesions which will cause scarring, which we don't want. So definitely that time the treatment interventions are very much required. So laser treatment, there are two kinds of laser treatments. It's not just the laser treatment. I'll elaborate in the other treatment modalities also, which we have. Like one thing is laser treatment can be done for the prevention of the, first thing is for the prevention of the acne. Laser treatment can be done. And for the scarring, many of times we prefer doing laser treatment for the sequelae, like for the scarring and the pigmentation of the acne. And for the prevention of acne, this is my personal approach. Like I prefer going for like the medical treatment. Along with that, I do peels and stuff like that. With that only patients, and there are other cryotherapy, and there are different therapies which we do so that the pimples are under control. So getting pimple under control is not a big issue for us. Like that is like easily achievable thing. But treating the scars and the sequelae becomes a challenge. See, antibiotics we don't give for long term. Okay, so for acne, antibiotics at the max, what I give is for a month maximum. And after that, 1 month or 1.5 months, after that, it is not required. So by the time the infection and everything is settled, we skip using the antibiotics. But definitely we have to give other medications also which will keep the acne under control, which we give for a long term if the patient is fitting into the criteria of if the patient is indicated to use these medications. So probably when we give medication, we try to focus on the retinoid, basically isotretinoin. These are the main treatment approach for the acne patients, which are very much useful, not just for the prevention of lesion, but also for so that new lesion should not come. That is the most important thing which we have to think, that prevention of the relapse, prevention of the appearance of new lesion, and patient should be acne free for a longer duration of time, which we try to look at. So antibiotic you don't use very regularly actually. So once a patient has come to us, like I usually give a time frame of 2 to 3 months for the pimples to regress. And after that, I tell them, yes, for a few years, you have to continue the maintenance phase. That is very important. And then if they are in the maintenance phase, very rarely they do get the relapses about. So that time, only for the relapse, we have to give the medication. सी हर चीज का इलाज लेजर ट्रीटमेंट नहीं होता है. पहली चीज आई वांट टू मेक दिस थिंग क्लियर इन द माइंड्स ऑफ द व्यूअर दैट हर चीज का इलाज लेजर नहीं होता है. दूसरी चीज, एक चीज मैं बताना चाहूंगी कि जो लेजर है वो उसका जो प्रॉपर इंडिकेटेड यूज किया जाए, जैसे कि जब उसका इंडिकेशन है तभी हम करेंगे, तब उसका मैक्सिमम बेनिफिट मिलेगा. सो इट इज नॉट लाइक कि हर पेशेंट आएगा तो लेजर करिए. हाँ, डेफिनेटली laser is one thing which has like really revolutionized the treatment of the cosmetic treatment, and उसके results भी बहुत अच्छे होते हैं, and if done properly उसके side effects भी नहीं आते हैं. So but I have to say, if done properly, कि पेशेंट का स्किन टाइप देख के उसका प्रॉपर एनर्जी लेवल, कौन सा एनर्जी में हम कौन सा लेजर कर रहे हैं, तो वो सब चीजें टाइट्रेट करना बहुत जरूरी होता है. सो प्रॉब्ली व्हाट आई विल सजेस्ट, गेट इट डन फ्रॉम अ सर्टिफाइड पर्सन हु इज लाइक डूइंग लेजर इन अ बिग वे, एंड देन ओनली यू विल गेट गुड रिजल्ट्स. एंड हाँ, डेफिनेटली दूसरी चीज होती है कि कौन सी कंपनी का लेजर है, उसके ऊपर भी काफी कुछ होता है. सो नाउ डेज अ लॉट ऑफ थिंग्स आर देयर. Some lasers will give very good results because they are like good products. It's like अच्छा product होगा, it will give good result. अगर खराब product होगा, then results will be sub-optimized. So that way we have to see. So it's a big discussion. So
definitely. So ma'am, for like any kind of treatment that we take for acne, there can be some of the other side effects also of these
yes.
kind of.
Yes.
What are the side effects?
Basically, for anything, whatever we do, so we always have to दो चीजों का ध्यान रखना पड़ता है. फर्स्ट, उसका रिजल्ट क्या मिलेगा, what will the result, and second, side effects. So when I see the result is better and the minimal side effect which is there, which is can be tolerated for some time, if the patient is able to tolerate that for some time, then I'll prefer starting that drug or doing that treatment. So it is always that way. When a person is there who is not having much acne, एक दो lesions हैं, and then it doesn't make sense to start big drugs and start treatments for them. But a person who is there who has a lot of acne, when I see a lot of scarring will be there for long term, if I'll not treat that patient right now, and a lot of scarring will be there, then definitely that time abhi ka, for momentary मुझे side effect जो हो रहा है, like because of that there can be many side effects actually. So many side effects which are, they'll not be permanent side effect, but till the time the treatment is going on, the side effects will be there. So we have to counsel in such a way that, see, the side effects will be there. We know how to handle the side effects. The skin will be dry, lips will be dry, or maybe conjunctiva will be dry. So we have to handle them. We have to tell them, you have to moisturize your skin properly. You have to use sunscreen properly. You have to use lip balm. You have to use eye drops. So all these things we have to tell the patients. And one thing I've seen, that if you tell the side effects of the drug or whatever prior to that, that these things are expected and the ways to reduce that. So patient do accept the treatment very nicely, and then once they are accepting the treatment nicely, they will be getting results, and if results are seen, they'll be more prone for taking the treatment for a long term. So side effects can be there, but we have to play in a zone where we have to assess that, see, these side effects, we have to take care of that, and they are not significant side effect for their health, and definitely it is giving good results to them. Definitely we have to we can accept that. So nothing comes without side effect, but yes, we have to know how to reduce them.
Okay, so yes, the side effects are there, but as ma'am has said, there's nothing to worry about it. There's nothing to be scared of, because the proper treatment or cure for these side effects is also there. Okay, so ma'am, another question related to acne management. Many a times, many of the diseases are genetic. So this acne is also genetic, or there are other reasons only?
There is a genetic predisposition. If your father, mother have like grade 3, grade 4 kind of acne, you can be more prone for getting these acne. So definitely, yes, there is a genetic predisposition, but there are others. As I said, there are other factors also: the dietary issues, the lifestyle issues, your hormonal issues, your weight issues. So all these factors also have stress levels. So all these factors do have effect on our skin, and they are the contributory factors.
Okay, and ma'am, not only women, as we know that men also get acne. So
men are the major chunk of acne.
Okay, so they are the ones.
So we cannot leave men behind in acne thing, because usually in our OPD, females are equal number of men and women, and even men are more prone for acnegenic skin, and because of the hormones, their androgens, so they have they are more prone for acne. So it's a bit controversial statement. Only females are bothered more as compared to men, but men also do have a lot of acne issues. So, and they have scars also. And main thing is they are not worried. So that causes the sequel.
Rightly said that men are not worried. Even like females, they are more worried about it. Women are more worried about it. So that's why we see more number of females like in the taking the treatment.
Yes.
Okay, so ma'am, what will happen, like, because many a times people, as you have said, that men, they just ignore the symptoms, they just ignore their acne. So what may happen if the patient is not even taking the treatment of the acne, like in a long run?
So nothing will happen. Only for the timing, their skin will look bad. Cosmetically, it will look bad, and later on they'll be having scarring. Nothing other than that, nothing will happen.
Okay.
Yes.
So there are not severe any kind of problem that may occur, but yes, the scarring.
Yes, basically scars. And see, scars do have like role to play in a psyche level. So definitely, I make sure my male patients also do take treatment. I explain them about scarring. I give examples of Abhishek Bachchan and John Abraham, that see these people do have scars which we can see. So definitely we have to counsel them. So they should not have like scarred skin. Scars, no one should get scars.
Yes, definitely. Okay, and ma'am, as we were discussing about the lifestyle changes, like there are many things that we are including in our lifestyle that are leading to acne. So what are these lifestyle things that are leading to acne?
Yes, definitely. So one of the most important thing which we have to, especially if the viewers are like young, dynamic people, one thing which we have to take care is our diet. Diet plays a major role as far as skin is concerned. So we can say diet definitely has like a good amount of, if your diet is correct, your skin problems are like 50% solved like that only. So most importantly for pimples, what we say is that they should not have like dairy products. Definitely. Why? Because these are filled with all the hormones for the better extraction of the milk, and then these steroids do have effect on body. So definitely one thing is the dairy milk and milk products, in that cheese and paneer and everything comes, and which like cheese is like one thing which majority are young viewers are like prone to eat a lot outside. So one thing. Second thing, outside food, because we don't know what they are adding, the kind of material they're using to make the food. And the thing is, they add a lot of food additives so that the taste enhances, which is very bad for our body as well as skin. So second thing is outside food. Third thing is fried food. And one more thing is like food high in glycemic index, like very sweet or very high glycemic index food definitely is bad for our skin. Not generally for our acne, but for our skin as such. So definitely our diet just shows off in the form of our skin. So if your diet is proper, if you're eating, if you're drinking a lots of water, hydrating yourselves, good amount of vitamins and minerals are going into your body, then definitely your skin will be showing effect. And if they are missing, we can make out from the hair and skin that definitely this person is deficiency is there, and then this person needs treatment. So we definitely, through skin, we can definitely comment about the diet thing of the patient. So one thing is the diet. The other thing is stress, or like if the patient is not sleeping proper. So definitely they do it creates a stress in our body, which will increase the cortisols in our body. And these cortisols are steroid like substances, which will have a bad effect on our skin. So definitely stress is one of the factors. Less exercise, if the patient is not exercising enough, definitely then chances of you not getting pimples will increase, but definitely your internal mechanism won't be that efficient as it is for a person who is exercising better. And lack of sleep and stress is like these are the few factors which will have effect on the acne. So yeah, definitely a good lifestyle will definitely pay you off.
Yes, of course. So having a good lifestyle is very essential, and maintaining a proper diet is also very crucial. So these factors plays a prominent role. And ma'am, apart from this, like mainly in women, what they do, they apply a lot of skin products. And nowadays there are like lots of varieties of skin products, and there are various brands also. So they'll try to experiment on their skin.
Yes,
So is it really good for the skin of women, or they should completely avoid it?
See, what I'll say is half knowledge is always dangerous. And the kind of products they are marketing nowadays over the counter. I'll say these products are good. I'm not blaming the product, but how to use them, people don't know that. And they'll land up in side effects, because we see a lot of patients coming up with side effects associated with the products. So majority of times these patients, what they do is they apply all these products for pigmentation, for acne or stuff like that, and they don't know how to take care of the skin after that. Okay, so what happens is they don't know that they are supposed to use sunscreen, they're supposed to moisturize their skin, how much time they're supposed to apply that product, they don't know, just they apply blindly, and then they land up in side effects and come to us. So that's why I ask patient, please don't do that. Consult your dermatologist. That person knows your skin. That person will prescribe you whatever you want from your whatever kind of skin you want for yourself. Will prescribe products according to you, and then definitely you can start using them, and you will not land up in side effects. Many a times the pimple prone skin, the side effects, the treatment associated side effects are severe. So if the patient is not following the routine properly, then the patient might land up in a severe problem. So we should definitely avoid that. This is what I would suggest.
This is very important for women. Whenever you're applying lots of product, be really careful with what you're applying, as ma'am has said.
Yes.
Okay. And ma'am, let's take another question from our live viewer, and this is from Shubham Maran. And ma'am, he's asking, doctor, which sunscreen is better for acne?
With sunscreen, depend actually. Once what happens is, if you are having a very oily kind of skin, we try to give a matte finish kind of sunscreen, which will have a matte finish, which will not cause dryness of the skin. But once we have started the treatment and the skin is very dry, and with the help of products, usually what we try to do is we make the skin drier. Okay, with the help of the creams and the tablets, our skin becomes dry. At that time, we have to moisturize the skin also. So depending upon that, we have to give sunscreen. Actually, at that, especially sunscreen can change during winters also. Winters we have to give different sunscreen, summers we have to give different. So according to it's not just one per product for a person, but definitely what I'll suggest, whatever you are doing, whatever product you get, at least apply good sunscreen. That will like prevent majority of your problems. So application of sunscreen is most important. Maybe initially you may not like the feel of it, you may not like the texture of it and everything, but definitely if you are we can switch to different products, 2-3 products, and then we can decide on a good sunscreen, and then we can, yeah, definitely it should be medicated. That is the one thing which we have to be very careful about.
Okay. And my next question is from Dhananjay Dubey, and he's asking, and what happens if we are not using any kind of face cream? Because it is mostly seen that men, they don't even apply anything on their face. So his question is, what will happen?
Nothing will happen.
Okay.
Nothing will happen. Only the trauma associated. See, if you are not using anything, it's not depends what you want. So if you are happy about your skin by not using anything, I'll prefer you being happy than. But if you're concerned that, yeah, I'm getting pigmentation, my skin is not looking good, then definitely you should meet a doctor and then start using them. So it's all about your psyche. Like if you are really happy about your skin, if you are like totally confident that yes, I have the best skin possible for me, then please you don't need to apply anything else.
And ma'am, there are people who eat a lot of like vitamin medicine for the proper healthy skin. So there's a related question over here from Ishita Jha, and she's asking, ma'am, it is necessary to take vitamin capsules for a healthy skin?
If you're eating proper, if your diet is not deficient, then definitely you don't need it. But if you are like, if we feel that your diet is inadequate, you are on some protocol where you are not eating proper, then definitely vitamins, because if deficiencies are there, then definitely it will affect each and every organ, including the skin and the hairs. So it's important to eat these vitamins if deficiencies are known. Yes, and they do have effect.
Okay. And ma'am, what are the fruits which are good for the glowing skin or to make the skin acne free?
If acne is the concern or pigmentation is the concern, then citrus fruit will have better edge over others. But in generally, what happens is we should always mix and match. It's not just one fruit which is important. We should each and everything has different constituent, a specific thing which is important for a particular step. So what I suggest is, yes, if you're having pimple prone skin, then definitely citrus fruit are better. But along with that, you should eat everything, other fruits also. It's not that they are bad, and every fruit has like something or the other which is unique for that fruit and which will impart good results. So mixing and eating everything is most important. That's not just for the food, for everything. And moderation is the key. It's not like that you should eat. So always remember the rule of moderation. If you're doing everything in moderation, then definitely it will give good results.
Okay, and ma'am, another question from a live viewer, and it's from Sonia Iyer, and she's asking, ma'am, how do I avoid a white cast with sunscreen? Whenever I apply sunscreen, I get some white spots.
So these white casts, they are typically seen in sunscreen having physical sunscreen, zinc oxide based sunscreens. So you can switch to a different product which is not having zinc oxide, so that the white cast can be removed actually. So basically the sunscreen which are having basically the physical sunscreen, they leave a white sheen like thing which people doesn't like it. So nowadays there are many sunscreen which are like a BB sunscreen, which will like make your skin thoda sa makeup kind of sunscreen also. Then there are vitamin C and all the ingredients in your sunscreen. The market is like huge when we see the sunscreen market. And we have to select a good product. That is the most important thing. And then we have to start using that. And there are products available which will not cause the white sheen. So that problem can be avoided by switching your sunscreen to a different brand.
Okay. And ma'am, what is the proper skincare routine that even men and women both should follow in their daily life?
Yeah, that is a very important question. And proper skincare routine for right now we are talking about pimples, so I'll probably focus on the pimple part. First and foremost thing, don't overdo things. Don't use a lot of toners. People do like scrub karte hain, toner karte hain, ye acha hota hai skin ke liye. Don't overdo these things. So that is one thing which I will say. Second thing is use a proper face wash. First thing, like if we are talking about acne, probably like we can use salicylic acid based, mandelic acid based face washes and lactic acid based face washes, which are basically which work on the pathogenesis of the acne. So with only face washes, if the mild grade of pimples are there, we can reduce them. Okay, so first thing is wash your face properly. Then if you are into a lot of skincare routine, I'll suggest if you for pimple prone skin, I'll prefer a vitamin C based serum which you can start to use. And over that you have to apply sunscreen. So use of sunscreen is most important if you are having pimple, because we have to give you treatment for pimple, and with the treatment, if you're not using sunscreen, then you won't be able to tolerate the treatment, and if you're not tolerating the treatment, you will stop the treatment and you will land up in relapse, or you will land up in not getting adequate result. So first thing, a good face wash, then a good serum and the sunscreen routine. And many a times people don't know that sunscreen should be reapplied. So at least for my patients, I tell them at least 3 times in a day you're supposed to use sunscreen. So it has few moisturization also, so your skin won't be dry, because with our treatment we make the skin dry, so dryness will be taken care of. And it is like a protective covering to the skin, because we know now that our ozone layer is not there, the sun rays are totally damaging for our skin. The most importantly, we have to use sunscreen, as well as 14 hours we are in front of laptop or media, so that the IR radiation also do have bad effects on our skin. So we have to use sunscreen while working also. So that nowadays that only while going out we have to use sunscreen has been gone off. Now the new dictum is you have to use sunscreen while sitting in your office also. So 3 times sunscreen use you have to do. And along with that, night routine, usually depending on the grade of acne, the treatments given, and along with that, moisturization. So that is the good skincare routine which you can follow throughout your day, and which will keep your skin in a better shape as compared to when you're not doing anything.
Okay. And very effective actually, which should be followed by everyone. So this is for all the live viewers. I hope you have kept the proper note of it. Okay, and in the end, what is the message for all our live viewers who are asking so many questions and trying to know about acne management?
So one thing I will like to tell each and every person, that first thing is like do take care of your skin, because that is a very important aspect. And one thing I tell my patients also, it is like what after looking at the mirror, what conversation which you have with yourself just reflects your confidence which you project in front of others. So that if the conversation which you have with yourself is correct, then you will project the right kind of confidence. And that is the most important thing, the confidence which you project in front of others, because that is needed for each and everything. Like if you are in any conference or doing any other work, whatever work you do, so that confidence is most important. So love your skin, pamper it, and do take treatment if required. Otherwise, at least take care of your skin and eat proper and exercise, and try to follow a healthy lifestyle. That will like take your skin to a better level for long term.
Like, subscribe, and press the bell icon. Thanks for watching. To know more about acne management, watch the full talk show with Dr. Tanuja Tamhankar from Pune on Beautiful Spotless Skin FB page.